Thanks, Richard, and thanks, Sophie, as well. That was a really illuminating discussion, I think, and highlights a few of the things that I'm going to talk through. And thanks to the AHSN for the invite to talk here and to really try and explain what we've got going on in Leeds in regards to a place-based approach to innovation. I was going to ask it from the floor in the last discussion, but I won't. But my first comment around the separation, I guess, between the NHS, social care, other bits of the city, the third sector, and charities, and etc., is actually there needs to be a means of engagement across sector, and that's one of the things that the Lapp, the Academic Health Partnership in Leeds, has been trying to develop over the last couple of years. So I'm just going to talk through some of the things that we've got up and running, some of the priorities for Leeds and how they link to some of these big regional and national strategies, and actually a few ideas about what we can maybe all do in our local places to really get things like local government, NHS organisations, the third sector together and really talking about innovation and adopting it. So that's the title. How do we get people to live healthier lives for longer? That's the core challenge that we've got in Leeds and in other areas. And the Lapp is designed to pull together all of our energies across the Leeds system to really begin to move on some of this stuff, really. So the priority for the Lapp, which is all the partners around the table, I'll go on to that in a second, is to collaborate on a series of innovative strategies, but more importantly, a series of delivery mechanisms that will really get certain things up and running around workforce, around personalised medicine, and most importantly around bringing together funders, bringing together collaboration and having a really tight strategy on the ground that builds on those three things over there, which is the capability of the universities, which in Leeds, you know, we've got three big universities, a large number of students, a large number of academics, and historically they've been slightly disconnected from the city and from local government. But likewise, the city and local government has also had a degree of disconnection. There's maybe been a bit of mistrust of the academics on the hill and a perception that they're not playing the part in city life, really. But the challenges across the system are so great that we can't have this silo-based approach anymore. We've got to bring these systems together, really. So a few points around who's initially around the table. We're going to build on this. So it's all the universities in Leeds, the City Council, all the NHS trusts, obviously the AHSN, but increasingly the third sector as well. So recently Yorkshire Cancer Research and St John's Hospice have joined the Lapp as well. And the key thing with this is it's a jointly funded initiative. So whilst we've got all the chief executives around the table, as mentioned in the previous conversation, you really do need that senior level buy-in. Most importantly, all of those chief executives have agreed to fund the Lapp on a fair shares basis. So that's CCGs, the Acute Trust, the Mental Health Trust and different bits of the City Council, the Economic Development and the Social Care bits, putting money into a process that encourages and supports system-wide innovation. So where we're at in Leeds, Leeds has got a large number of digital health jobs, 22% of the total. You know, we've really got to build on those skills, really got to build on that and feed those into frontline, ground-level innovations. We've got a large number of students and obviously we've got the universities as well. We've got a huge budget for the city for health and social care and increasingly a single commissioning voice with CCGs, but also with local government as well. So that gives a real amount of power and scope to really change things, whether that's locally, whether that's around adoption and spread, or increasingly whether it's understanding what the challenges are for the city, but as well how they relate to the region and some of the national agenda as well. And I think most importantly, we've got economic growth in Leeds as well. We've got a thriving business sector, that's SMEs, but it's also some big national players as well. And many of these organisations are connected into national and international discussions. So one of the things that we're trying to do through the Lapp, I think the person from Roche earlier mentioned, sometimes it's difficult to navigate the system, is to help businesses navigate the Leeds health and social care system and to put them in touch with innovators locally, with primary care where necessary and with acute trusts where there may be need for clinical trials or whatever else. So that was the optimistic bit, previous bit, but you know, there's no point sugarcoating challenges that we've got at the moment. There are some huge citywide challenges. Many of these reflect the national issues that I think we're facing. It's well known, it's well rehearsed that people are living longer, but often in poorer health. We have an ageing population. In Leeds, we have some advantages because we've also got growth in the population under 25. So that's good as a cohort effect for future generations. But what it does mean in the interim is that the working age population is squeezed between a large amount of spend on children and young people and obviously the ageing population. So we've got to get better at dealing with our workforce, at dealing with our economy and getting the most value out of the people that are already in the working population. We know that we are scheduled to have an even further increase in the number of people with multiple long-term conditions over the next few years. So unless we move on the prevention agenda, this problem is really going to cause us some real serious issues, not just in the health and care system, but across the wider economy as well. And again, a northern issue, not particular to Leeds, but maybe exacerbated in terms of inequality, where we've had a large number of economic growth, where we've had growth in high-tech jobs. We've also got a growth in poverty, in inequality, and an increasing number at the moment of minimum wage jobs in the system too. So somehow we've got to provide opportunities for those people and career ladders to get them maybe into jobs with a little bit of social mobility. And obviously one of those opportunities is work in the health and social care system. We do know we've got some shortages, both in the acute sector, in the community sector, in primary care, in nursing in particular, but also across the wider economy and obviously the STEM roles as we know. We're struggling to recruit across the piece. Whereas at the moment, obviously, we know we've got future challenges, maybe from technology, so we need to do something about this, and I've got a slide on that later, really. So, in relation to the previous conversation, I think, and obviously partly my role is in the City Council and getting the City Council to sign up to innovation. There tends to be a little bit of a view that things like the Northern Powerhouse, the industrial strategy, the NHS 5-year forward view are slightly disconnected from some of these problems, slightly disconnected from the challenges on the ground of inequality, really. And to some degree, I think they are. But obviously, I think what we've got to do is to translate those into local action, really. And the Academic Health Partnership, one of its main roles is to understand the implications of all these big, important national strategies and to make them relevant to frontline practitioners. So one of the ways that we've done that is by developing quite a creative health and wellbeing strategy, which will run over the next, it's got 4 years left, essentially. There are 3 main priorities within that, which is to make sure that we move away from a silo-based approach. As you can see in the centre of there, we've got wellbeing, starts with people, everything is connected. So that's our digital strategy, it's moving on innovation, it's ensuring we get adoption. We set an ambitious target for Leeds to be the best city for health and wellbeing, best large city, best core city. And a recent look at a basket of 27 indicators from Public Health England indicates actually we already are the best core city. And we've made some really significant progress over the last 2 to 3 years, driven by a really innovative partnership-based approach of which the Lapp is a key part. The one bit that absolutely we need to make some more progress on is the bit there, basically. Healthy and caring city, where the people who are poorest improve their health the fastest. And the challenge with that is the challenge of health inequality. The fact that, for example, in relation to things like obesity and smoking, we know they're increasingly concentrated in areas of multiple deprivation. And in fact, the gradients in some of those are worsening, not improving. So the challenge is to use some of the strategies that we're developing, to use innovation, to make sure we've got adoption and spread, and that we target that innovation in those areas of multiple deprivation. So we do have some good opportunities on that. We're redesigning what we call in local care partnerships, which other areas probably call accountable care at the moment. But we're doing it in a particularly Leeds way, which is having everybody around the table, from elected members, obviously GPs, mental health services, the university sector, the third sector and charities, and we're bringing everyone together around smaller populations